The gastric band, or the lap band, is the commonest weight loss procedure performed in Australia. It's the easiest from my point of view and the safest from your point of view. It has a mortality rate in Australia of less than 1 in 1,000. As many of you may know, the band works by producing a small pouch at the top of the stomach. Then when you eat, the pouch fills up, you feel full, and you don't take as many calories in. The band doesn't change your ability to absorb the calories that you eat. So if you're able to get 5,000 calories in, you'll absorb 5,000 calories and you won't lose weight. The band is performed with keyhole surgery. It involves an overnight stay. The day after your operation, you have an X-ray test to show the position of the band, and that is useful if you have any difficulties with your band in the future. Following that, you'll then start back on a liquid diet, and over the next 3 or 4 weeks, the feeling of restriction will slowly disappear. When you come back to see me in a month's time, you'll be able to eat freely, and at that point we start to adjust the band. There's a little port that sits underneath the skin, just below your breastbone, and I'm able to access that with a needle and tighten the band up. On average, it takes about 5 adjustments to get the band set at the right level for each individual person. Adjustment of the band is a little bit more of an art than a science. The key to it is not to make the band too tight. If you make the band too tight, then you tend to eat foods that are easier to get down, the softer, the ice creams, the cookies, the milkshakes. These are all high in calories, and therefore you don't achieve the best possible weight loss. With the band, you're aiming to lose about half a kilo a week, and it takes you about 2 years to attain your maximum weight loss. There are some dietary changes necessary with the band because it's a restrictive procedure. Tough fibrous foods like the lump of steak off the barbie can prove difficult, and therefore we encourage you to take minced meat or casserole meat that's easy to get down. We encourage you not to drink too much with the band when you're eating. There are 2 reasons. One, if you take a big glass full of water or liquid, the pouch will fill up and you'll find it difficult to get anything else in. Also, if you drink a lot as you eat, you tend to wash the food through the pouch and you don't feel as full, and therefore you take more calories in. We encourage you to sip as you eat your meal, but to drink in between meals. Eating with a band in place, your meal becomes an event. You have to chew your food well and eat slowly. We encourage you not to try and do other things while you're eating, such as reading a book or watching TV. There are a number of complications associated with the band. The most significant one is a band slip. In a band slip, the band doesn't actually move. The stomach slips underneath the band, and this usually presents as pain at the top of your stomach, particularly when you eat, together with some difficulty in keeping food or liquids down. This is an urgent medical emergency, as very occasionally the part of the stomach that slipped underneath the band can have its blood supply cut off. A band slip is usually simply treated by taking all the fluid out of your band. That's usually sufficient to allow you to be able to eat and drink. You will require an operation to either reposition the band or take it out and convert the band to a different type of operation. The risk of band slippage is about 5%. It has been decreasing in recent years with change in the band technology and changes in how we put the band in. However, a band slip can happen at any time. It can happen at 1 month, 1 year, 10 years. Other problems with the band is a condition called band erosion. In this case, the band works its way through the stomach wall, the stomach heals behind it, and then suddenly you find you can eat whatever you like and you've no restriction. The risk of a band erosion is less than 1%. You can have other issues with the band, such as problems with your port, port infection or the port moving, and you might need minor operations to adjust that and correct that. Overall, the studies would suggest that the risk of needing another operation after a band is about 20%. As I've said previously, the band is the commonest operation in Australia. It is the safest and the simplest. And if you work with the team, you will achieve a good weight loss. On average, you're looking at 55 to 65% of your excess weight loss over a 2-year period.